And so hats off to St. Mark's Baptist Church and UAMS for this special effort on this Saturday. If you look at the cases, yesterday we had 5,612 cases here in Arkansas, and we have an additional number of new cases of 163. That brings the total cases to 5,775. And of these new cases, I noted that the top two counties were Benton County, 23, and Washington County had an increase 20 cases. Dr. Smith will be able to elaborate some of the other counties that had an increase in cases over the last 24 hours. In terms of hospitalizations, we had an increase of 5 that are hospitalized. That brings us to 86 in hospitalizations. We have an additional 2 deaths, brings us to 115 in terms of Arkansans who have died as a result of COVID-19. Now, let's look at the chart for a couple moments here. The first one, of course, is number of new cases. 2 days ago, I guess it's 3 days ago, we had the high water mark of 450 plus new cases. Then it shot down fairly consistent in the last 2 days in the 150 range. Let's go to the next one. I think you will see that the 7-day rolling average of new cases, that you see one peak here of about 160 new cases, and then the rolling average across the way that you see a second peak. And that's the point I want to emphasize, is that it's clear and evident to me that we have one peak, and then we've had a deep dip, and then we're having a second peak right now, and they're really about 30 days apart. If you look at the next one, is the number of currently hospitalized, and here you can see that we're maintaining at about 82. We've had a dip down and a dip up the last days, 5 down and an increase of 5 today, so that remains fairly steady there. But let me stop here just for a moment and say, how should we respond and react to what is evident to me, that you've got a peak 30 days ago, and then you've got a second peak here in the last couple of, and I'll make about 5 points here. First, this should lead us to recognize that the record level of testing that we're doing in Arkansas helps us to find more cases, and that allows our contact tracing to be more effective, quicker, and responsive to the number of cases that we see. And part of that is the expanded testing means that we have improved our early warning system, which is our radar to know where we have cases in Arkansas and how we deal with that. And if you look at the next one, it does reflect the number of tests that we're doing by date, and the last 24 hours we've had 3,195 tests. 3,195 tests, and so you can see the consistency in our increased testing over the last 10 days in particularly. And then the second observation I would make about this second peak I've referenced is to keep an eye on our hospitalizations. The fear from day one was that we would not have enough hospital beds in Arkansas to accommodate the number of COVID-19 patients that need that hospital care. Well, we are in good shape in Arkansas now, and we will be in good shape in the future. If cases go up, and that's why I say watch the hospitalizations, if cases go up, but hospitalizations have less of an increase, then that means we're identifying many who are positive but not very ill. And this is a good thing, and it's indication as part of our broadening of our tests that we're not catching only those that are symptomatic, but a broader range of those that will ultimately not require hospitalization. The third thing that's important to watch, and I think you can go to the next one, is the positivity rate. And this is the percent of COVID-19 positive tests by date of result. Here again is 10%, which is what is set as the national standard and what we're trying to make sure we can stay below. And here, with increased testing, our positivity rate has actually been in the 5% level, which is 1/2 of the national standard. So very happy with our positivity rate, even though we're testing more and more. So watch the positivity rate because the low rate indicates that we're getting ahead of the spread. In fact, the last 24 hours is 3.5% in positivity rate. And fourth is watch the deaths. This is a sad thing. We don't like to talk about it because it hurts us when we lose any Arkansan as a result of COVID-19. But if you look at it on a per capita basis compared with the nation, Arkansas has one of the lowest death rates in the country as a result of COVID-19. We'll continue to watch that and monitor that to see if there's any problem that develops. And then finally, the fifth admonition and lesson I think that we see from where we are right now is that we need to invest in your personal safety habits. Increased cases indicates that there's more Arkansans that are out there than we knew about before that are positive and could potentially spread the virus. We need to be aware of that as we go about our daily activities and not be casual. This morning I received a text from a friend in Northeast Arkansas who had information from hospitals and the test, and the story was that there were positive cases coming out of a high school swim party. A high school swim party that I'm sure everybody thought was harmless. They're young, they're swimming, they're just having activity, and positive cases resulted from that. And so it's just an encouragement for us to be disciplined in our activities. And during this Memorial Weekend, we want to be out. We want to ourselves. We want to remember this holiday and those that have served our country and given their lives in service of our country. But let's be safe and let's be disciplined at the same time. And then quickly, let me give you an update on the pandemic unemployment assistance payments. That was why we're building the new website to get these payments out. We continue to have an increase of the money that flows out. As of noon today, we have 12,930 claimants, almost 13,000 claimants that have been approved, and the payments have been made either by direct deposit or by debit card. And so I want to express my appreciation to all of the the state employees and the Department of Finance today, Sunday, and Monday over the holiday to continue to process these payments and get them out, as well as those in the Department of Commerce that continue to man the phones as well. Finally, and I said that a moment ago, but we do have a lot of technical questions that come up. And Dr. Smith and I have talked about this, and so I'm creating the Governor's Technical Advisory Board in which Dr. Austin Porter III of the Department of Health will be the chairman of this Technical Advisory Board that will help us to look at new technologies, whether it's an app that will help us in contact tracing, or whether it is other technologies that will help us to manage and build the infrastructure that we need for the fall. I want this Technical Advisory Board led by Dr. Austin Porter III to make recommendations to me, but also to evaluate the new technologies all across the country that might be helpful to us as we continue this virus. With that, Dr. Smith, I'll turn it to you.
Thank you, Governor. I'll just give a few more details on the numbers. As the Governor mentioned, we had 163 new cases. 3 of these were in correctional facilities, so 160 were in the community. So our total is 5,775. Of these, 1,564 are active cases. 88 of those are in nursing homes. 509 are in correctional facilities, and 967 are in the community. In terms of nursing homes, we had 8 additional nursing home residents test positive, so our total there is 358. And we've had 3 additional nursing home staff test positive, so our total there is 204. We currently have hospitalized 86. That's a net increase of 5 from yesterday. We have 17 currently on a ventilator. That's an increase of 3 from yesterday. And we've had 2 additional deaths, so our total deaths are at 115. We have had recovered 4,096. That's 67 more. In terms of testing, as the governor mentioned, we received reports on 3,195 tests yesterday with a positivity rate of 3.5. That brings us to a total of 54,866 for the month of May. So we're on track to meet and exceed our goal of 60,000 tests in the month of May, really before the end of the month. Our total number of tests since the beginning of our testing here in Arkansas is 105,628. In terms of our new cases for today, our new community cases, the 160, we had 23 of those from Benton County, 20 from Washington, 17 from Yell County, 17 from Sevier County, and 12 from Pulaski County. All the other counties are less than 10. So we are using this information to focus our testing efforts. Again, testing is available in 79 of our local health units throughout the state, Monday through Friday. In addition to that, we are doing targeted testing in communities. Today, we are testing in Springdale. Next week, on May 29th, we'll be testing, and on Saturday, May 30th, we'll be testing in West Memphis, Pine Bluff, and DeQueen. And then Saturday, June 6th, we'll be testing in Jonesboro, Wrightsville, El Dorado as well. And we will continue to do those extra testing events wherever we see an increased number of cases. And with that, I'll turn it back over to the governor.
Terrific, and we have to take any questions.
Can you tell us more about that swim party that you mentioned?
It's just an anecdote. I couldn't, I'm not going to be able to share exactly what it was or the circumstances of it, but it is an important anecdote for people to understand how easy that spread, and that we still need to be careful.
Can you say a little bit more about the new case in Benton and Washington counties? Do you know if those are related to outbreaks at poultry plants?
Dr. Smith, you want to comment on that?
Certainly, we don't have all the details on those yet because they just came in. What we do know is that in Benton County, most of those were in Rogers. We have had some family clusters, at least 3 family clusters there. And in Washington County, these have been mostly in Springdale. We don't have information at this point whether they're related to poultry plants, but we do know that there are communities that are being affected.
Is there any question from
Yes, Governor, good afternoon. Neil Gladner in Hot Springs. When you talk about the unemployment rate yesterday, I'm just curious, and this might be a technical question, but traditionally I think the people who are covered under the pandemic assistance plan had not been eligible for unemployment. Do those people count into the unemployment rate that you talked about yesterday?
Yes, that would be true. And we can look at it more technically, but the design of the unemployment rate that is nationally, and the Bureau of Labor Statistics carry that, that could be anybody that would work anywhere, and as long as they're in the job market, either looking for a job or elsewhere, I would think that they would be included. I'll have people double check that, but it would feel fairly confident that they would all be included in that number, but Neil will check into that further.
Thank you.
Thanks, Neil. All right, let's take one more question remotely, then we'll come back to the table. All right, we'll come to the table.
Can you say a little bit more about the technical questions that were coming up and what kind of technology the state might be using in the future?
Well, for example, there's been some discussions about the Google app or other apps in which people can download that, and that will help them to know if they've been in contact with a positive case somewhere. And this is North Dakota has utilized that app. Dr. Smith points out that there's actually a low participation rate by the public because of privacy concerns. But that's an example of technology discussed nationally, and that's one of the reasons as I have this technical advisory board, I want to have someone from DIS that might look at it from a privacy standpoint as well. So it's not just about bringing new technologies in, but it's also about data and how comfortable and how the citizens would react to whether it's a data collection or new technology. So that's one example of it, but it's obviously others in terms of how we can utilize it, software in contact tracing, how we can beef up our technology investment, and also cybersecurity side of that, because as we collect data, we want to make sure that that is protected as well. So that's just a start of some of the areas that I would want this technical advisory board to consider. All right, our final question. All right, it's Saturday, it's weekend, and you won't see me, Lord willing, tomorrow or Monday, but we do hope to see everybody Tuesday. Thank you very much.